Can OTC flu medicine interact with other prescriptions? When you're feeling under the weather and reach for over-the-counter flu medicines, it's easy to assume they are safe and simple to use. But did you know that some of these medicines can interact with your prescription drugs? Understanding these interactions is key to managing your health safely during flu season. Most OTC flu remedies contain multiple active ingredients. For example, acetaminophen helps reduce fever and relieving pain, but taking too much or combining it with other products containing acetaminophen can risk liver damage. Always check labels to avoid doubling up. Decongestants like pseudoephedrine and phenylephrine are common in these medicines. They help clear nasal congestion but can raise blood pressure, which might interfere with medications for high blood pressure. People with hypertension or heart conditions should use these cautiously and consult their healthcare provider. Phenylephrine is sometimes recommended as a milder alternative for those with high blood pressure. Non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and naproxen, are also often included for pain and fever. These can interact with blood pressure medications, potentially making them less effective, and increase bleeding risk if you're on blood thinners. They can also affect kidney function, especially in people with pre-existing kidney issues or those taking certain medications. Antihistamines are another common ingredient, especially in combination cold and flu products. They can cause drowsiness, which might be worsened if you take sedatives, sleep aids, or certain antidepressants. Combining these can impair alertness and increase the risk of accidents. Regarding antiviral medications like Tamiflu, they generally do not have significant interactions with OTC medicines. However, if you receive the nasal spray vaccine flu mist, taking Tamiflu at the same time might reduce its effectiveness. Supplements like elderberry are sometimes used to ease flu symptoms, but they can interact with immunosuppressant drugs used after organ transplants or for autoimmune conditions. Elderberry might influence immune system activity, so it's best to discuss its use with your healthcare provider. To stay safe, always read the labels carefully to avoid taking multiple products with the same active ingredients. Inform your doctor or pharmacist about all prescription drugs, OTC medicines, vitamins, and supplements you're using. This helps prevent harmful interactions. If you have chronic health conditions like high blood pressure, heart disease, or are on blood thinners, consult your healthcare provider before using OTC flu medicines. Remember, combining multiple sedating drugs can cause excessive drowsiness or respiratory issues. Follow dosing instructions precisely and never exceed recommended amounts. While OTC medicines are generally safe when used correctly, some combinations can pose risks. Always seek professional advice if you're unsure or managing complex health conditions. Being informed helps you treat your flu symptoms effectively while keeping your overall health safe.